this job as Shadow Secretary of State for Health and Social Care, I did so in the knowledge that we have a huge challenge. Because even though we all in this hall have been treated by our National Health Service, and some of our families and friends' lives have been saved by our NHS, we all also have something else in common. As members of the Conservative family, we've all been accused of wanting to undermine the core principles of our National Health Service. So let me be very clear from the outset. The National Health Service will always be free at the point of use under the next Conservative government. And we'll strengthen it, harness it, and make it even better. Because I've seen what our health services in this country do every day for people. Before becoming a Member of Parliament, I worked in the hospice movement and saw the wonderful services that they provide to children and adults across the country. When families face the most challenging times in their lives, our hospice movement and our NHS is there to support them always. But let's look at what Labour and this Labour government has done in the last 14 months. Strikes, despite huge pay rises that Wes Streeting signed off on. Remember when he told us to get around the table? Well, perhaps he should listen to his own advice, because more strikes are threatened. And remember when they criticised NHS reorganisation plans? Well, they started their own reorganisation without any funding allocated to deliver it. Now, I'm not against reforming our NHS. Conference, the Conservatives always back good reforms. But we are a party that always makes sure we have the money to pay for it and the will to deliver it. Because our NHS staff need certainty, certainty to do the job that they love with stability and a clear direction from their government. But Conference, I also want to be constructive in opposition. Where government seeks to bring about meaningful and effective reform, we will not oppose for the sake of opposition. We will look at the detail, we will ask the difficult questions, and where we can agree, we will be constructive. Because at the end of the day, we want an NHS that works for the patient. It was in that spirit that in my first week in this job, I attended the cross-party talks on the future of social care. For too long, governments of both colours have failed to address the increasing demands on social care, which is putting strain on NHS budgets, local government budgets and the personal budgets of families across the country. We will engage in these talks in the spirit of seeking a genuine long-term solution. It's not going to be easy, but I believe it's the right thing to do, to sit down and talk and find areas where we can agree. My vision is simple: a health and care system where patients are in control, staff are valued, and innovation is harnessed to save lives and improve well-being. This isn't about ideology, it's about outcomes. Whether you are a patient waiting for surgery, a carer looking after a loved one, or a nurse working a night shift, what matters is not the politics, it's whether the system delivers. And I am ably assisted in this task with a fantastic Shadow Health and Social Care team who have real experience in these sectors. So thank you to Dr. Caroline Johnson, Dr. Luke Evans, Lord Kamal, Dr. Neil Shastri-Hurst and Greg Stafford. Thank you. Now, clearly, we as a party are embarking on a major policy renewal programme, and today, for what I think is the first time ever, you will be given the opportunity to vote on what you think should be the key priorities for the next Conservative government. To help in that task, I'm delighted to be joined by Lord Markham, CBE, who will be advocating that we need to use technology to build a truly 21st century National Health Service. By Dr. Kartik Karvi, who is a GP who will argue we need to get patients out of hospitals and into primary care. former Olympic swimmer Sharon Davis, who will make the case for prevention being better than cure, and Dr. Robert Kilgore, who is the founder of the Social Care Foundation, who will argue for reform of our social care system. But before I call our first speaker, please scan the QR code that you will see on the screen so that you can download the app and you can take part in that vote. I will remind you about that as the pitches go on. So now, let's begin.
Thank you. So I believe I only have 2 minutes for my X Factor audition. So here goes. Please vote for me. Now, I truly believe that tech has the potential to really transform health in the same way that we've seen it happen in banking, retail, communications, and social media. And the good news is actually we're already doing a lot of this already. My proudest achievement as a health minister was to start us on this journey. 33 million people now have the NHS app. A quarter of them, 8 million of them, use it every month to get their medical records, get test results, make appointments. But we can do so much more. It really can be the front door to the NHS. When you think about it, when you see a doctor, you're relying on their experience, the cases they've seen, to diagnose you. When you're using technology, you've got every instance, every case ever happened, that record to make the diagnosis, which is going to be right for you and your circumstances. It will give you a much more accurate diagnosis and transform the way we access healthcare. I went the other day to get a mole checked out. My wife had been nagging me for ages, and I was expecting to strip down and everything. The receptionist got out a phone, took a photo, emailed it off, and I got my AI-based scan and results back negative, thankfully, just like that. And that will just transform. It will transform the way we access health. And the good news is that we have the best data in the world to train AI, because AI is only as good as the data it rests in. And we've got 70 years of NHS data, GP appointments, hospitals, specialists, and you use that data to train the AI so it can read the cancer scans, it can read your x-rays, it can read your MRIs more accurately, quicker, and cheaper. But it can do so much more as well. Technology can give us precision medicines, personalized cancer treatments, which will train your own immune system to attack the cancer cells in your body. Our data puts the UK in a pole position to transform healthcare and be the world leader in health tech and innovation, and the Silicon Valley of health tech, to the benefit of UK patients, UK startups, the economy as a whole. Please vote for technology.
Thank you, Nick. I'm now delighted to ask Sharon Davis to come forward, former Olympics swimmer, and as we know, a passionate campaigner on physical activity, who will argue that prevention is better than cure.
Thank you. Good morning, ladies and gentlemen. It's always really nice to stand next to one of those. I grew up standing next to one of those. That's pretty good. Excuse the fact that I'm going to read off a script, because when they said 2 minutes, I thought I'll never be able to do 2 minutes if I waffle on without a script. So here we go. In 2022, over 1 billion people were living with obesity versus 390 million who were underweight. And this year, obesity now exceeds those underweight in all regions of the world. In the UK, 28.7% by our WHO figures are obese, and the most recent data telling us 64.5% of our population are now overweight. Without meaningful action, obesity rates and the associated economic costs are expected to continue to rise over the next decade. Nesta reported this year that £226 billion are lost per year to obesity, which is reducing the quality of our lives. 12.6 billion directly by the NHS, with a huge increase in type 2 diabetes, heart disease, and cancer. And here's a fascinating little fact, because I love them. The average Japanese citizen consumes 200 calories per day less than the average American citizen. And the truth is, we're going in the direction of America, not Japan. So what are those contributing factors? Well, of course, the change in food habits, food processing, and easy access to food has influenced unhealthy weight gain. Policies related to agriculture, urban planning, education, and marketing also play a significant role. The affordability and accessibility of healthy foods and opportunities for healthy exercise are often varied by income and region. Our jobs are more static, Our phones are rarely off, and our exercise habits have changed, but not for the better. Now, it won't surprise any of you that I'm a huge advocate for prevention rather than cure. It, of course, saves us money, but being physically active also boosts our energy levels, increases our feelings of confidence, and gives us pride in our commitment. The saying goes, a healthy mind is a healthy body, and that's proved without doubt the link between physical and mental well-being, and both are a huge challenge to society today. I know personally how much happier I feel when I haven't missed my regular training session, as I'm sure looking at all of you, you feel exactly the same. Local authorities are currently required to provide essential services, and proponents argue that sports and recreation should be included as a legal requirement rather than an optional service. You won't be surprised to know that I actually agree with that as well. Investing in leisure facilities is investing in our local community. Since COVID, we've lost over 400 swimming pools, a sport that I'm obviously passionate about because it can be done from cradle to grave and save lives. Though on the national curriculum, it's not Ofsted checked, and in areas of deprivation in particular, nearly half of all our children are now leaving school not being able to swim 25 metres. We need to support more not-for-profit organisations in sport, connect to clubs and encourage more school sport, creating lifelong fitness habits. It's the biggest reason I still do exercise today. It's a good habit, I'm addicted to it, and I'm addicted to those endorphins which make me feel happier. We need to build non-traditional ways, cheaper and more eco-friendly sports facilities, make planning permission easier and offer free sessions for children, the elderly, those unemployed and the disabled. Investing in physical fitness and programs will improve mental and physical well-being, and it will save the National Health Service money. It will also create a happier and a healthier country, which is what we need.
Thank you very much, Sharon. I'm now delighted to invite Dr. Kartik Kavi, who is a recently qualified GP, who will argue that we need to get patients out of hospitals and into primary care.
So some of you may wonder, when it's 8 a.m. and you're struggling to get a GP appointment, what's so good about primary care? The answer is efficiency. GPs deliver 90% of NHS patient contacts on 10% of the NHS's budget. GPs also deliver care in the community, where patients live and work, and this leads to continuity, which we know improves outcomes. So why should we, as Conservatives, care about this? Well, GP practices work in ways that other parts of the NHS struggle to do so. GP practices are private businesses. They need to make a profit and remain attractive so patients don't choose other services. Productivity is incentivized. Success is rewarded. And unlike large NHS trusts, with their rigid bureaucracies, GP practices are decentralized, which means they can innovate and adapt to meet patients' demands. So how can we help GP practices? Well, the Labour way would be more regulation and more mandates. The Conservative way must be more empowerment and freedom. Let's let GPs compete with hospitals to provide services. We already do this with things like joint injections, but let's extend it to things like cauterization, endoscopies, and routine interventions. GPs will be able to provide this locally, faster, and at a cheaper rate for the taxpayer. The NHS is free at the point of use, but it is not free at the point of misuse. Let's let GPs, within reason, set reasonable consequences for repeat, inappropriate, missed appointments. And lastly, using financial incentives and training, let's increase the role of GPs with special interests. This will help bring down hospital waiting times. Primary care is local, efficient, and decentralized. With the right supports and freedoms, it can alleviate the pressures on the NHS. Thank you.
Just a reminder, we will be asking you to vote shortly, so if we can get the QR code up again, please do make sure that you scan on that, download that app, and we'll be ready for voting. Now, our last but not least is Dr. Robert Kilgore, who is the founder of the Social Care Foundation, who will be advocating for reforming social care.
Thank you, Stuart. Good morning. I'm very pleased to anchor this illustrious quartet. I hope you're all having a good conference. Now, I've been working in social care since I opened my first care home in Scotland in 1989. And yes, I did have a full head of hair at that time, and this is the kind of thing that happens if you are involved in social care. But social care is a real people business, and I've always enjoyed working in both this challenging but also rewarding sector. And during the COVID pandemic, I was so proud of all our frontline social care heroes, ordinary people doing truly extraordinary things every day. The vulnerable in our society and the amazing staff that care for them desperately need us to step up and help deliver meaningful social care reform, ideally cross-party. Millions of families are desperately trying to do their very best for their loved ones, and they urgently need our help and our support, including our ideas about how to make things better. The past is the past. We must learn from it, yes, but we must be brave and bold and move forward in a positive and constructive manner. It is a fact that you simply cannot fix the NHS without first fixing social care. They are two sides of the same coin. It's not rocket science, it's basic common sense. If social care collapses, what will happen to our NHS? We'll have more bed blocking, more cancelled operations, and longer NHS waiting lists. More conservative policy research is needed urgently in this area. We really must get on the front foot on social care reform. Together, let's make social care better. Thank you, and enjoy the rest of the conference.
Well, there you have it. You've got those 4 pitches brilliantly delivered. So now is the opportunity for you to vote. Please, if we can get the code up again, just make sure you scan that and then vote. And we will. I'm not sure you can vote for yourself.
What? Multiple times.
Go ahead, go ahead. Look, whilst people are voting, I just wanted to... Oh, it's turning into chaos now.
Multiple votes.
Can't get the relay members, can you, these days?
Let's take a seat. I just thought, whilst people are voting, we've a minute or two to vote. All of your pitches were really, really important. And I think the reality, whilst this is a bit of, this is good to do to see where people think, it's a combination of all of these things and much more, isn't it, that needs to be done.
I mean, actually, technology, I think, is brilliant for prevention. Again, having your own personalised, likelihood of having cancers, heart disease, and the advice on the sorts of things you should do around your diet that you were saying, so you can prevent that risk of heart disease. They absolutely go hand in hand.
Yeah, and in terms of, sorting out social care will also be a big...
Yeah, I mean, all of this needs to just be integrated with the GPs at the centre of it. We need to use technology. We need to prevent people from coming to see us. And when they do see us, we need appropriate social care. So I think it is all integrated, definitely.
And when people no longer have a clinical need to be in hospital, they must be out in the community, either at home with a home care package or in a care home. But if they stay in hospital, it's not only bad for them and their families, it's also hugely more expensive for the taxpayer than being, so it's a win-win, and it's something that we should definitely do. Cool.
Yeah. Well, from my perspective, it's both, isn't it? It's about improving the quality of everybody's lives, and it's about spending money so we have money available for all the other things that we need. And prevention is the way to do that. We have a happier, healthier public, who have a better quality of life, and it's cheaper for all of us.
Brilliant. Well, I feel like I'm sort of Simon Cowell now to say the results are in, and we're going to announce them. There we go. So prevention is better than cure has got 38%. Bringing the NHS into the 21st century is 29%. Future of social care 18%, and primary care 15%. Really interesting snapshot, but as we said, Look, all of this and much more has to work in tandem. And that's why my shadow team and I are really wanting you to get involved in this policy renewal programme. We want to make sure that we do the right policies, answer the right questions, test the policies, and also think about how we're going to implement it, something this government clearly haven't thought of. Thank you for taking part, thank you for being here, and let's look forward to building a great set of policies for our NHS and social care. Thank you.